posted. We will, I believe, have time for Q&A at the end of the webinar. We did have a bunch of pre-submitted questions, so thank you so much to those of you who submitted those. We'll go over a couple of those first, and then if there's time, we'll be able to answer some questions, and you can feel free to submit those questions through the chat box. But again, we'll really try and save those for the end. And then just one quick thing to note before we dive in, we have a pretty broad audience today. We've got local health department people, we've got community-based organizations, we've got state government people, we've got people from outside of Maryland. So we've got this really great broad audience, and so the content will be reflective of that. We'll sort of try and touch on as many things as we can. And so while keeping it pertinent to everyone who's here. So just to be aware of that. So I think that's all the housekeeping things I had to say before we dive in. So let's go ahead and go on to the next slide. So we'll do just this is the brief agenda of what we're going to talk about today. We'll just do a quick overview of contact tracing and MD COVID alert. Again, because this is such a broad audience, we want to make sure everyone's on the same page. Some people are outside of the states. We want to keep everyone up to speed on what contact tracing looks like in Maryland. And then we'll talk a little bit about what contact tracing looks like at this stage of the pandemic. Things have obviously been shifting a lot lately, so we want to make sure that we're sort of situating ourselves in what's going on right now. Next, we'll do a little bit, we'll talk about what we've learned over the past year, and so Brandon will be taking us through a deep dive into the data. Then we'll talk a little bit about where our contact tracing efforts are focused now, some communities of interest. And then finally, we'll end with different ways that you can help support your community. So that's what we're going to talk about today. And then, of course, we'll end with some QA. Next slide. So the people that are going to be presenting today will be myself. As I said, my name is Sarah Linden. I am the manager for Health Education and Outreach for the Contact Tracing Unit at the Maryland Department of Health. Also presenting today will be Perry Carroll, who is a community health educator for minority and vulnerable populations. And then Brandon Blouse, who is one of our fabulous epidemiologists here on the Contact Tracing Unit. Next slide. And now I'm going to hand it over to Perry to give a brief overview of contact tracing at MD COVID Alert.
Thank you so much, Sarah, for that introduction. Okay, so we're going to be briefly talking about what contact tracing is, and then that smartphone exposure notification system, MD COVID Alert. So what is contact tracing? Contact tracing is an essential public health tool used for decades to slow or stop the spread of disease. It's been around since the early 1900s. It involves contacting people who are infectious with the disease, we call them cases, and getting in contact with people who possibly were exposed to those infectious individuals, and we call those possible contacts. So how does it work for COVID-19? So to prevent further spread of disease of COVID-19, cases are asked to isolate, and possible contacts are asked to quarantine and monitor themselves for signs and symptoms of COVID-19. Now, I do want to know we are in the era of vaccines. People in Maryland are getting vaccinated, are fully vaccinated. So if you're a possible contact, if you were exposed to someone who's infectious for COVID-19, fully vaccinated and have no COVID-like symptoms, no COVID-like symptoms, you don't need to quarantine. But we want you to get tested 3 to 5 days after your exposure, wear a mask in public indoor settings for 14 days, or until you receive a negative test result. Next slide. So what does contact tracing, what does the flow look like in Maryland? So let's say someone decides to get tested because they start having symptoms. They go get tested, their test comes back positive. Now that positive test result is received into our system, and within 24 hours of receiving that positive test result, contact tracing is initiated. So that contact tracer calls that case, that person that tested positive, to provide them with needed resources and isolation instructions. And of course, we collect information on possible contacts, people that they might have exposed to COVID-19. The contact tracer then interviews those possible contacts, provides them with needed resources and instructions on how to quarantine, and lets them know that they've been exposed. Now, we don't just do this one-time call. We follow up with our cases and possible contacts to make sure they can successfully and safely complete their isolation and quarantine, and to check in on them and make sure that they have all the necessary support and resources to complete isolation and quarantine. So what can you expect from a contact tracing call? Now, contact tracers will ask for your date of birth, your address, and this is to confirm that we're speaking to the right person. Since we will be talking about personal health information, we want to make sure we have the right person on the line. We'll, of course, ask if you're having any symptoms and how you're feeling, so we can connect you to any care. We'll, of course, collect the information on your possible contacts and provide any assistance or resources. Now, there's something that contact tracers will never ask. And if you ever get these questions from a supposed contact tracer, that's a scam, not a contact tracer. We'll never ask about Social Security information, financial or bank account information, personal details that aren't related to COVID-19, your passwords, money or payment, or your immigration status. We are there to support you, to tell you've been exposed, to let you know that you've tested positive, and to support you through your isolation and quarantine. And this is always a question we get from the public, is about confidentiality. We know it can be kind of nerve-wracking to talk to someone over the phone about personal details, but our contact tracers ensure confidentiality and take extreme measures to protect your privacy. So during that contact tracing call and you talk about your personal contacts, when those personal possible contacts are called, we do not disclose your name of the person that possibly exposed them to COVID-19. We just say the date of the exposure. We do not tell them the name of the person. We also only share information with the Maryland Department of Health and local health departments. So none of your personal identifiable information is ever shared with outside agencies like immigration or housing authorities. So resources and assistance. So I keep talking about these resources and assistance. So every local health department has a COVID hotline. You can find general COVID information here, jurisdiction-specific COVID information. They can answer questions about isolation and quarantine and provide needed resources to safely isolate or quarantine, whether that be groceries or pharmaceuticals, anything of that nature, things that you would need that you can't get because you were in isolation or in quarantine. So now I want to talk to you guys about MD COVID Alert. Some of you guys might have this already on your phone, but let's go over background on what this exposure notification technology is. So this is smartphone technology that lets someone know that they might have been exposed to COVID-19. Now, we developed this system to help with contact tracing. It's not there to replace contact tracing. We still need people to participate in our contact tracing calls. But basically, if you were exposed to COVID-19, you would receive a notification on your phone, like shown in this picture, that you were possibly exposed if you have this tool enabled on your cell phone. So how does it work? So when two MD COVID Alert enabled cell phones are in close proximity, which is 15 minutes or more, 6 feet or less, within 24 hours, and later one of those phones decides to report a positive test result, that other phone will receive an exposure notification like we saw on that picture in the slide before. Now, this is completely anonymous. It does not say the person's name who exposed you. It doesn't even say the cell phone number or any personal identifiable information. So you don't know who exposed you, but you know that you've been exposed. It uses low energy Bluetooth technology, doesn't use GPS, doesn't drain your battery, and again, it doesn't collect any personal identifiable information, but it does rely on people reporting their positive test results. And it relies on people having this enabled on their cell phone. So the more people that have this enabled, the better this system and this program will work. So you've been alerted. What should you do? So if you're fully vaccinated, we want you to monitor your health for signs and symptoms of COVID for 14 days. Get tested 3 to 5 days after receiving that exposure notification on your phone. Wear a mask in public indoor settings for 14 days or until you receive a negative test result. If you're fully vaccinated and you're experiencing symptoms, get tested and isolate yourself because you might be a case. And if you're not vaccinated, we ask you to get tested, monitor your symptoms, and quarantine for 14 days since you've gotten that exposure notification on your phone. And of course, everyone should participate in contact tracing. So since you were exposed, you might also be named as a possible contact in a case interview. So if you see MD COVID or that phone number, 240-466-4488, please answer the call. That is a contact tracer trying to tell you important health information. And so that was just a quick, brief background on contact tracing and MD COVID alert. And now I'll let Sarah take it away.
Great. Thanks so much, Perry. So I know this has sort of been a question on everyone's mind. What does contact tracing look like now? You know, we sort of fully understood what it was and the purpose of it back maybe a year ago, but now things are very different, sort of, than they were a year ago. And so a lot of stuff has changed. So where does contact tracing fit in now? What does it look like? So you can go on to the next slide. So just to really drive home the point, contact tracing is still happening. It's still happening all across Maryland in all 24 jurisdictions. It is still an incredibly valuable tool in the fight against this pandemic. And so to give you some context, back in January, so January of 2021, which was sort of where the surge was happening, the height of the cases, the contact tracers were receiving almost 3,000 cases a day. And about 2,300 possible contacts per day. And so over the entire month of January, we conducted over 60,000 case interviews and almost 38,000 possible contact interviews. So doing the math on the fly here, that's like 100,000 interviews that were conducted only in the month of January. So back in July, which ended a couple days ago, the numbers obviously are a little bit lower than they were back in January, but they're not zero. They're not nothing. We received in July an average of about 200 cases a day, and an average of about 340 possible contacts per day. Throughout the entire month of July, we conducted over 4,000 case interviews and over 6,000 possible contact interviews. So again, even though it's not 100,000 interviews that were conducted in January, we still conducted over 10,000 interviews in the entire month of July. So that's not nothing. We're still doing contact tracing at a very high rate. So if you could go on to the next slide. So of course, when we initially put these slides together, the case counts were lower. Things were feeling like they were slowing down. That no longer is the case in a lot of places. So case counts are on the rise pretty much everywhere across Maryland. So you can see here, I've circled these last two bars at the end where you can see that the case counts really are on the rise again. And so contact tracing continues to sort of power through and make all of these work to trace and track all of these different cases. So just a couple of other things to draw your attention to on this chart. You can see here it starts in March. March to April, yeah, so the case counts were still pretty high back then. But you can see here there's the first red dotted line. That's when the vaccine was available for everyone 16 and up. And you can see right around there, the case counts really do take a pretty steep decline, and they have this sort of slow march downwards. And then the second red dotted line would be when the vaccine was approved for 12 to 15-year-olds. So again, those case counts really did drop fairly low, but as I mentioned, you can see there down at the end with the red circle, case counts are on the rise again. And so contact tracing continues to be an essential tool in helping keep those case counts down. Next slide. So why? Why do we still need contact tracing? Why is it still needed at this stage of the pandemic? So as Perry mentioned, it's an incredibly necessary tool to help to reduce disease transmission. by getting people into isolation and quarantine as quickly as possible. So at this point in the pandemic, we are really able to reach out to people fairly quickly after their positive test, which is a huge help in getting people into isolation and quarantine as quickly as possible. But contact tracing also does a lot to identify spreading events, so identifying those clusters or those outbreaks. We are also able to, through our data, identify communities that are the most impacted by the disease and ensure that they receive the necessary support services. So it's not just that we're helping to reduce the transmission by getting people into isolation or quarantine, but we're also doing a lot of epidemiological investigation and helping to make sure that the communities that are in need aren't forgotten about. And so, lately, a lot of restrictions have been lifting. The mask mandate has been lifted. Schools are getting ready to reopen. And so as we continue to lift these restrictions and head towards a more quote unquote normal life, contact tracing remains sort of one of the most effective tools that we have in controlling this pandemic. And so we know that as restrictions rise, it does seem like case counts are going to take a small bump. And so we really are able to jump in and help control that. And in addition to what I said, we really are necessary to containing the outbreaks that may occur as a result of some of these restrictions lifting. Next slide. So I know the question on everyone's mind is, what about this variant, right? So Delta variant, that's been in the news, that's sort of on the top of everyone's mind. So one of the reasons that contact tracing continues to be so important is that contact tracers really help with tracking new virus variants. So how do we do that? How do contact tracers play a role in variant tracking? Well, contact tracers they identify cases that would be good candidates for sequencing. And so sequencing is what helps us identify variants. And so contact tracers, through their contact tracing investigations, are able to identify people who might be good candidates for their specimen to be sequenced. So we really are the ones identifying the people and getting those specimens into the lab for sequencing. We're connecting those dots there. We're also contact tracers are really important when it comes to identifying where and when variants are emerging in our communities. So which communities are really seeing high levels of variants, and how is that spreading, and sort of tracking that progression. So contact tracers do a lot when it comes to variant tracking and progression. So again, this becomes even more critical as Delta is now the dominant strain in Maryland. So, this is very much on top of everyone's mind, is thinking about sort of how the Delta variant is impacting the pandemic and our communities. Next slide. So aside from the sort of more fundamental epidemiological reasons why contact tracing is important, or the variant and the outbreaks and the actual controlling of the pandemic, there's another additional element that is so important, and that's that social support component that Perry was talking about earlier. So a contact tracer is often the first person someone speaks to after testing positive. And so this can be, if you could, Theo, if you could get those slides back up. Sorry about this. Theo, you're no longer sharing your screen. I can see his screen working. Oh. Well, there we go. Perfect. Thanks, Theo. All right. Right back into it. Okay, right. So contact tracers are often the first person someone speaks to after testing positive. And so this can be kind of a really scary thing for someone to test positive for COVID-19. And so being able to speak to a trained professional who can give them, who can talk to them about what it means to test positive or what it means to be exposed and provide them that guidance and connect them to resources, that's really important. So being able to receive test results or the notification that you've been exposed from a trained professional is really, really helpful to our communities and to allow people to ask questions that they have, connect to resources, figure out where they can go if they need help. So that's sort of a really important element to contact tracing that's not often talked about, but is important to remember. So again, not only will contact tracers provide really valuable information about how to isolate or quarantine, sort of, how long should you be isolating or quarantine? What are the things you can do? What are the things you can't do? What do I have to do if I'm a mom and I have small children? Like, there's all these questions around how to properly, safely, and securely isolate, and contact tracers are really there to answer all of those questions. But they're also there to help connect you if you need food assistance, if you need someone to go to pick up your medicine from the pharmacy. We can also connect people to the other elements of the pandemic response, such as testing and vaccination. So contact tracers really do provide those wraparound services and provide a point of contact for someone who might not have, say, a primary care doctor or access to any of those resources, or someone that they can turn to for information. Next slide. So again, what about the vaccine? I know Perry talked about this a little bit, but contact tracing really works together with vaccination to help stop the spread of the disease. So it's all part of one larger, robust pandemic response. So the vaccine is doing incredible things, and we really encourage everyone to get it. But contact tracing remains incredibly important as well. So, and why is that? Well, number one, not everyone is vaccinated. So about 60% of Maryland's population at this point is fully vaccinated, which is wonderful, but 60% is not 100%. And so, vaccines for various reasons, we're still at about 40% unvaccinated. So of course, for kids under the age of 12, they can't get vaccinated. The vaccine has not been approved yet for them, but there are still people out there who are hesitant to get vaccinated. They're just not sure yet. And then again, there are people with very specific medical conditions who can't get vaccinated. But all of that is to say, we're not at 100% vaccination rate yet. So we still have whole swaths of the population that are not vaccinated. And so that's why it's important to contact trace not only unvaccinated, but the vaccinated population as well. Contact tracing can also be used as an early indicator for waning vaccine efficiency. So we are collecting data on who has been vaccinated and how far along in their series they are. So we're able to keep a close eye on those vaccine breakthrough cases. Next slide. So I mentioned why unvaccinated people need to participate in contact tracing, but also, as we mentioned, vaccinated people do also need to participate in contact tracing. So why is that? So though rare, vaccine breakthrough cases are expected. No vaccine is 100% effective. Although these generally are incredibly effective, we still do see vaccine breakthrough cases. And so that is to be expected. And so that will increase as a proportion of total cases as vaccine coverage increase. So the more people that are vaccinated, we will expect to see more vaccine breakthrough cases, just proportionately speaking. So if they do test positive and you've been vaccinated, you obviously should participate in contact tracing, because that means you have COVID-19 and you're infectious. And so we need to get you into isolation. And then new data, I know there's sort of the data on this is still ongoing. There's nothing definitive yet, but some new data does show that vaccinated individuals who test positive are able to spread the disease. So we, just out of an abundance of caution, we want to make sure those people are isolating. An exposed vaccinated individual should quarantine if they aren't fully vaccinated yet, meaning their final dose was not within the past 14 days since exposure. So if it was less than 2 weeks prior to the exposure, they're not considered fully vaccinated and will need to quarantine. And then if they're experiencing experiencing any symptoms, they will need to quarantine. And I'm sure you all noticed, but the CDC did just push out new guidance that they are recommending that vaccinated individuals who have been exposed do get tested 3 to 5 days after exposure. Next slide. Okay, great. I think that was it for me. I'm now going to hand it over to Brandon, who's going to talk about some of the data that we've collected.
Okay, so I'm Brennan Blouse, one of the epidemiologists in the CTU, and I'll talk a little bit about the data we collect and the insights we've gained from it this past year. Next slide. So what data do we collect? Well, a lot of the information we obtain is what a contact tracing program would elicit for any disease. Things like basic demographics, reported symptoms, places of potential exposure, and names and contact information for individuals who may have been exposed. We ask about vaccination status and use of Maryland's exposure notification app. We even ask qualitative questions, such as why cases sought testing or where they think they were exposed, in order to get at information about the exposure pathway from different angles. All of this is housed in our contact tracing database known as COVID-Link. Next slide. Of course, we also collect internal data on interview progress and outcomes to assess the effectiveness and efficiency of contact tracing in general. Here you can see our case and contact outcome cascades, which show the number of individuals added to COVID-Link and how many were reached and interviewed. All cases diagnosed with COVID-19 are entered into COVID-Link. Of those, about 80% are reached by contact tracers. Reasons a case wouldn't be reached include missing phone numbers, not answering calls, and cases being beyond their isolation period by the time their positive test gets into our system. You can see the drop-off between each category, but ultimately about 70% of cases and 60% of contacts completed an interview in our first year. COVID-Link did not launch until June of 2020, so not all COVID-19 cases in Maryland are documented in the system, but the roughly 375,000 cases added to COVID-Link in our first year represent over 85% of all cases reported in Maryland during the pandemic up to that point. Next slide. As you can imagine, investigating nearly 900,000 case and possible contact records over the course of a year requires a huge amount of manpower and effort. At the peak of the pandemic, we had well over 1,000 active users in the system, many of whom were conducting case interviews throughout their workday. During the first year of COVID-Link, investigators logged nearly 2 million phone calls using the built-in COVID-Link phone system, an average of about 1 call every 15 seconds. However, this is a significant undercount, since only 2/3 of investigated cases were contacted using the built-in call system. Many health departments use their own phone lines, so those calls are not recorded in our database or included in our estimates. Next slide. But the volume of effort put in over the last year is not evenly distributed across time. It has risen and fallen with the volume of cases reported each day. Here we have a chart that illustrates the outreach trends we've seen over the past year. The gray bars show the volume of cases coming into the system. You can see the first wave last summer, then the second surge around the holidays, and then the increase we saw this spring. The red line is the percent of cases where a contact tracing attempt was made within 24 hours of us receiving their positive test result. This is one of the most important metrics we track, as the probability of eliciting an interview response and quarantining contacts decreases the longer we wait to reach a case. You can see the decreases in that metric during those first 2 surges, but no decrease during the spring 2021 wave, showing that we were appropriately staffed up and prepared at that point. The orange line follows the same trends as the red, but refers to the percent of cases we reached successfully within 24 hours, meaning we actually were able to speak with the correct person. Since those cases are a subset of individuals who had a contact attempt within 24 hours, the orange line is always lower than the red one. Beyond tracking our internal performance, we are constantly monitoring trends in what information cases and contacts are reporting to us. Here you can see a chart illustrating trends in different employment categories reported by cases who worked outside the home during their incubation period. We have highlighted the dark blue healthcare category here in order to show the steep drop-off in the percent of cases who reported healthcare employment immediately following the Maryland vaccination campaign that was launched in December 2020. You can also see the slow reversal of this decline as the proportion of vaccinated workers in other employment categories begin to increase, which diminishes the relative advantage that healthcare workers had in reduced susceptibility. Next slide. Contact tracers ask cases many questions about where they have gone, who they have seen, and corresponding dates during their infectious period. A slightly less scientific but still interesting question that we added to the interview late last year is the question asking cases where they thought they were exposed and who might have exposed them. This chart shows the cases reporting likely exposure at home, at work, or at a family gathering. You can see that family gatherings and non-household family member exposures peaked around the holidays last year. There's also a steep decrease in suspected household exposures in spring 2021, around the time that Maryland rolled out vaccines for most age and risk groups. Much of the data you just saw is available for public inspection on the Maryland Department of Health coronavirus website. For those of you who are interested, we encourage you to check it out. Numbers are updated weekly and include information on case volume and interview outcomes, high-risk gathering trends like family gatherings, concerts, and religious services, and employment. Next slide. As Perry mentioned earlier, Maryland's MD COVID Alert system is our mobile technology for alerting individuals to potential COVID exposures. Since MD COVID Alert is completely anonymous, we don't receive any data on users or their exposures, but we do have an idea of the volume of users subscribed to the service. Since MD COVID Alert went live in November 2020, we've seen over 2 million phones enable the service, which would account for about 1/3 of Maryland's population. However, many of those devices are not actively used, so we estimate the real number of active devices at around 450,000. Most of those devices were enabled the service within the first few weeks of launch. Next slide. Based on published literature of the impact that exposure notification programs have on disease transmission, we estimate that MD COVID Alert has potentially averted between 1,000 and 4,100 cases as of May 2021. The number of potential cases averted is proportionate to the volume of cases being reported statewide, so you can see that MD COVID Alert made the biggest impact during the winter surge shortly after it launched, although it continues to play an important role in slowing the spread today. Next slide. Now I'll pivot a bit to discuss some of the projects we are currently working on in CTU. As you've already seen in the preceding slides, we have a lot of data. By mapping interview outcomes by zip code, we can highlight areas of Maryland where contact tracing hasn't been as successful. In this map, the yellow, orange, and red zip codes are areas where less than 60% of cases were successfully interviewed. There are many reasons for differing levels of outreach success, including the level of morbidity in a given zip code and the contact tracing staff capacity in that area. Mapping these geographic differences can help us assess where there's room for improvement and what areas can serve as examples to model effective contact tracing procedures moving forward. One of the biggest topics in contact tracing right now is the looming 2021-2022 academic year. The Department of Health is coordinating with the State Department of Education to make sure that the return to school this fall is as safe as possible. Since children under the age of 12 are still not eligible for vaccination, the risk of potential spread is higher than for older students in high school and college. So we are especially paying attention to younger populations right now. We've been closely monitoring cases associated with pre-K to 12 schools and colleges since before most students returned to in-person instruction. Associated in this context means the case reported attending, working, or visiting a school location while potentially infectious. Thus, faculty and parents could also be considered pre-K-12 or college associated. This chart shows the trend from the start of school in 2020 through June 15, 2021. The top chart shows cases associated with pre-K-12 schools. We can see the number of cases ticking up as many students return to in-person instruction in the spring. Similarly, the college-associated cases, shown in the bottom chart, also fluctuated during this period, as well as during the beginning of the fall semester last September. Though the proportions are low, 3% and 2% of all interviewed cases for pre-K to 12 and college cases respectively, when we stratify by age, 11% of interviewed cases aged 19 and under were pre-K to 12 associated during this time period, keeping in mind the fact that most students were not in school during this entire time period. Another way we analyze our data is to assess how well we are reaching and supporting various subpopulations across the state. In terms of racial and ethnic subpopulations, understanding who is not participating in contact tracing and who is lost to follow-up during the contact tracing process will help us refine our messaging and supportive services. Surveillance data for COVID, both in Maryland and nationally, has shown that Black communities have been disproportionately affected by the pandemic. You can see that in this chart, which shows more Black cases than white cases between March and June 2021, despite Maryland's population being more white than Black, as you can see in the small chart there at the left. Next slide. This is a similar chart to the previous slide, but is arranged by percentage rather than count, so that we can easily compare the ethnic groups to each other. Of the cases who had phone numbers, the percent reached is between 87 and 90%, and the percent successfully interviewed is between 78 and 83%. We see slightly more difference when we look at cases who name close contacts during the interview. Non-Hispanic Black and non-Hispanic white cases are less likely to name a contact compared to Hispanic and Asian cases. However, overall, we find that our outreach efforts are successful at relatively similar rates across racial groups, although it is worth mentioning here that this analysis is only of cases with known race collected at the time of testing. If cases who refuse to provide race data are less likely to complete the interview, this could potentially confound parts of this assessment. The most consistent aspect of our efforts over the course of this pandemic is that things are ever changing. The questions that we need answers to vary from day to day, and the ways that we can collect that information to best serve our constituents is constantly evolving. At present, we are in the midst of a major change to our database that should dramatically improve our ability to analyze trends in our data and find connections between our cases and their contacts. As you could probably guess, contact tracing for COVID-19 is not going away anytime soon. So we will continue to refine our methods and hopefully report back with more useful insights in the months to come. Mary, back to you.
I was muted. Thank you, Brandon, for sharing all of that great data that we collect. I'm going to be talking about how you guys can support your community. Next slide. So, of course, answer the call. If a contact tracer calls, if you see MD COVID, you see this phone number, please answer the call because they're there to provide you with important health information, help you if you've been tested positive, or tell you that you've been exposed and get you into quarantine as soon as possible so you don't spread the disease to others. Next slide. And then, of course, stay safe this summer. So we know pandemic fatigue is real. People want to enjoy time with their families. People are still traveling. The airports are packed. But if you are experiencing symptoms, get tested even if you're vaccinated. I know there's things going around like colds and other respiratory illnesses, but if you have any COVID-like symptoms, nausea, shortness of breath, headache, vomiting, diarrhea, anything like that, get tested. Doesn't matter if you're vaccinated, partially vaccinated, or unvaccinated. Also, you can notify your contacts if you do test positive. Of course, a contact tracer will call you and collect information on your possible contacts. But if you feel comfortable, you can notify them yourselves. You can advise them to quarantine if they're unvaccinated, get tested, and monitor their health for signs and symptoms of COVID-19. And of course, you can anonymously notify your close contacts by going to tellyourcontacts.org. So again, we know it's summertime, you want to go on vacation, but like Sarah and Brandon have shown, our case counts are rising. So we need people to stay vigilant and get tested, isolate if they're experiencing symptoms. Download MD COVID Alert. So MD COVID Alert is a great way to quickly notify people that they have possibly been exposed. So of course our contact tracers do that, but they have to call the case, get the information of the phone numbers and names of those possible contacts, and then call them. With MD COVID Alert, you go right into your phone, report your positive test results, and people will quickly get a notification that they were exposed and then can quarantine themselves, get tested, and monitor their health. It really helps people who are vaccinated. So you realize, even though you're vaccinated, you still need to monitor your symptoms, get tested if you're having symptoms. So it's a good way to stay on top of things. And of course, we want you to share your opinion with us. We are always looking to make improvements in our contact tracing program. We do have a brief online survey to help us learn what you think and know about contact tracing, that exposure notification technology, MD COVID Alert. The survey is open until September 15th, available in both English and Spanish. It's 10 minutes or less. You need to have internet access. It's completely online, but please take this survey and let us know your thoughts about contact tracing. And I believe Sarah's dropping that in the chat box now. So I just want to thank you guys for coming to our webinar and learning some information about the contact tracing unit. We will go to questions. I do want to say, just in case people are hopping off, that we do have an evaluation survey, just so we can know what you thought about this webinar and if you're interested in future webinars and things like that. So I will drop that in the chat, but now we'll dive into questions.
Thanks, Perry. And thank you all so much for sticking with us through some technical difficulties, but we made it through. So as I mentioned, we had a bunch of people that submitted questions in advance. So I will start with those, and then if there's time at the end, we will address some of the questions that showed up in the chat box. So the first question that was submitted was, for how long do health authorities expect contact tracing to continue? This is a great question, and I'm going to hand it off to our fearless leader, Marcia Perlowitz, to answer this question.
Thanks, Sarah. Good afternoon, everybody. The Maryland Department of Health continues to attempt to call every person who tests positive for COVID-19, as well as their named contacts. As Sarah and Perry just mentioned, providing timely isolation instructions and notification of exposure along with quarantine instructions is crucial to containing further spread of COVID-19, particularly as we learn more about the Delta variant. Additionally, contact tracing is a critical part of the continued education around COVID precautions and the availability of vaccine. As long as some people remain unvaccinated, there's still an elevated risk of severe outcomes for these individuals, including hospitalization and death. As long as that risk exists, contact tracing will continue to be a critical component of mitigating the spread of that disease, just like it is for TB, STIs, and HIV.
Thanks, Marcia. All right, we have another question here. This one is about MD COVID Alert. So how can you tell if MD COVID Alert is working? So this is a great question, and I'm going to let Perry answer this one.
Yes, so I know we get this question a lot. Once you enable your phone, how do you know that it's actually working? Well, I promise it's working. You won't receive a notification unless you meet, exposure CDC definition of close contact, which means your phone was in close contact with another phone for at least 15 minutes within 6 feet over the course of 24 hours. With MD COVID Alert, every 4 to 6 hours, your phone runs checking against other phones that have confirmed a positive test. So if you meet that criteria for an exposure, a notification will appear on your home screen. But if you do want to double check if it's actually working, if you go to your iPhone, go to the settings and click on exposure notification, you'll see a screen that says exposure logging status is active. If you have an Android, you go to your exposure notification app, it will say app is active and checking. So the app is working, but those are some ways that you can check.
Great, thanks, Perry. All right, we have a couple more questions. Let's see. We have the question, what steps are going to be implemented to contain the pandemic, keeping in view the emergence of the new variants? So I know we talked about this a little bit, but I'm going to hand this over to another of our team members, Theo, and he works a lot with the variant tracking, so I'm going to allow him to answer this question.
Sure, thank you very much. So regarding the first question, in terms of what we're doing in relation to these new variants, the new variants do present an ever-evolving challenge in our response to SARS-CoV-2. Unfortunately, they don't fundamentally change our approach or the tools that we use to fight the virus. Vaccines remain extremely effective against all known variants, including the Delta variant, in preventing severe outcomes such as hospitalization and death. Even with the emergence of Delta and the evidence that there is spread among vaccinated persons, universal masking and social distancing continue to prove effective at reducing the spread of COVID. And do you want me to take the next one, or?
Yeah, and then so I'll read we had a very similar question come in. That was, how frequently are COVID-19 samples tested for the Delta variant and other variants?
Thanks.
And go ahead, Theo.
Sarah. Yeah. Maryland, fortunately, has a very robust surveillance system when it comes to variants that involves actively identifying cases that are good candidates for sequencing, such as reinfection or vaccine breakthroughs, or persons who are infected after vaccination. At the height of our sequencing efforts, we were Maryland was sequencing over 1,000 cases each week. As case counts have fallen, so has the volume of cases that are eligible for sequencing. Currently, a few hundred cases are being sequenced each week, and for the month of June, this equates to sequencing between 20 and 30% of PCR confirmed cases. As our case counts continue to increase, we expect that the number of cases being sequenced will still increase. Unfortunately, we do expect that this will be kept in line with our target and having met the target of between 20 and 30% of cases being sequenced.
Great, thank you so much, Theo. So that was all of the pre-submitted questions that we had. And so I think we'll work our way through some of the questions that we got in the chat box now. In the last couple of minutes that we have. So the first question that we saw is Maryland currently recommending or considering deprioritizing fully vaccinated contacts for follow-up? So Marcia, I'm going to hand this one over to you.
Sure. So Maryland has not yet implemented any statewide deprioritization of certain cases or contacts. We are considering possible options and have been having discussions with some of our local health departments. But as the case counts continue to rise and our contact tracing staff continues to be stretched, we likely will. So happy to reach out to you, Holly, and chat about that more sometime offline.
Great, thank you. And then we had another question from Elena. Can you talk more about your data system and how you were changing it moving forward? So Marcia, do you want to take that one too?
Sure, happy to. So our contact tracing data system that we refer to as COVID Link here in Maryland is a Salesforce platform. The system was initially stood up rather quickly, as you might imagine, and was actually sort of first positive test result centric rather than patient centric or person centric. And so as the pandemic has kind of rolled forward and we've seen more and more reinfections and have additional data elements that we want to pull in to make decisions and provide proper guidance to cases and contacts such as vaccination or Immunet data, we are restructuring the back-end data model of the system in order to make the system person-centric. And so that's just sort of changing how all the different data elements that we are collecting are associated with one another, and it will sort of change how we're able to track various things and improve reporting and identification of connections between cases and contacts and locations that they visited and that sort of thing.
Great, thanks, Marcia.
Sure.
And then scrolling down, I see a question from Kathleen about, does that work only for in-state cases? And I know that was in response to the question about MD COVID Alert. So yes, right now MD COVID Alert does work with our neighboring states and territories, DC and Virginia. And so they do work in connection with phones from that state. The notification will come from your home state though. And I know that there's been some talks at Apple and Google about making it sort of work across even further state lines, but we're not quite sure about all the details for that yet. But as for right now, as people often travel between DC, Maryland, and Virginia, it works with all of those phones. And then I see Jacob's question, how do we face and respond to vaccine skepticism? That's a great question. I think a lot of people in public health have that. Unfortunately, I'm not going to dive too far into that right now, but MDH does have some great vaccine hesitancy webinars that we will be happy to include the links to when we send out the resources after this presentation. So similar to this webinar, the vaccine group did some vaccine hesitancy webinars. And so I think those are some really good resources that we'll make sure to include. Let's see. And then Brenda, is the state considering tracking breakthrough infections by vaccine? So we do track vaccine breakthrough cases. We are asking everyone, and we ask everyone that we talk to whether they've been vaccinated, and then we confirm their vaccination status in our vaccine tracking system. And so we are sort of keeping a close eye on vaccine breakthrough cases. Okay. Rowena, I see, was COVID link used by other states? So Salesforce is used by other states. Our version of Salesforce is called COVID link. So that's just for Maryland. But we know that other states do use the Salesforce platform, but COVID link is specific to Maryland. Okay. All right, I think that's, unless Marcia or Perry, you see any other questions that I've missed that you feel comfortable answering?
We can wrap up for today. I did see a few things in the chat that we can maybe follow up on directly offline with folks. And really just want to take this opportunity to thank you all for joining us today. I know the team was eager to share all of the work that we've been doing here in Maryland. And I know that we do have some folks on the line who are from outside of Maryland. So do feel free to follow up if you have additional questions. We're happy to talk more about how we approach contact tracing in Maryland and the work that we're continuing to do. So
yep, thank you all so much. And after this, be on the lookout. We'll be sending the slides along with the link to the recording once we have it, and any additional resources that we've talked about. So thank you all so much for joining, and we hope you enjoy the rest of your day.
Thank you all.